IntivaHealth. My name's John Hardigan. I'm the co-founder and EVP of Strategic Development and Partnerships. Intiva rewards doctors, nurses, all licensed medical professionals for taking actions within our platform. They can then use those tokens to purchase goods and services that they need to administrate their careers. Things like continuing medical education, medical malpractice insurance, diagnostic equipment, all different forms, all different types of goods and services that is specifically for medical professional needs. The current state of affairs is that doctors spend 8.7 hours on non-clinical, non-patient paperwork. Those are things such as credential management. They have to maintain 25 plus different documents from multiple different bureaucracies every single year. Imagine we have to go and get a driver's license every 5 years and have to go to the DMV and what a hassle that is. Well, they have to do this every year with multiple bureaucracies like that. Very time consuming, a lot of red tape that they have to deal with. It equates to $53 billion lost in inefficiencies on the physician side. Hospitals, on the other hand, have to wait for months from the time that they hire a licensed medical professional to the time they get them on the schedule because they have to go through primary source verification. That current platform, that current system is extremely antiquated, analog. Somebody is typically in a basement somewhere picking up the phone and calling on this list of credentials that they have for this medical professional and getting direct verification from previous sources like, hey, did this physician work at this hospital from this date to this date? And then they check the box. It's extremely inefficient, and again, it takes months. And we have one study that shows it's $7,500 per day per facility in lost revenue every day that that particular professional is not on the schedule. IntivaHealth puts this time and this money back into play in the United States healthcare system for better patient care and for ultimately better patient outcomes. Built on Hashgraph, IntivaHealth is the first integrative, decentralized credentialing, verification, and management platform. Our platform is built. It's on the market. It's in play right now. We have thousands and thousands of users using the platform every single day to consume continuing medical education courses on our online library, for example, looking for jobs, also using our HIPAA-compliant digital messaging system. The Hashgraph integration, and if you haven't heard of Hashgraph, they're here today. I encourage you to talk to them. Allows IntivaHealth to now put in the verification piece into our platform. It will be live this early summer. We will be the very first Hashgraph enterprise solution on the market. And it allows us to take that primary source verification that I mentioned earlier that takes months, goes to seconds. If you can think about the implications of that in the healthcare system, not only on the doctor side, but on the facility side. Physicians typically are working 60, 70 plus hours a week. The administrative side of their career tends to be an afterthought. If IntivaHealth, through our automation and our streamlining of the administrative process for physicians and facilities, can give back a few hours a week to a doctor. Imagine you're going to see a doctor for a very serious condition, and you want them at the top of their game when they're talking to you. If they get a few more hours of sleep that week, just because they used our system, or if they are able to see one more patient that day because they didn't have to spend that time on this arduous paperwork, then we know that that is going to impact the healthcare system in a dramatic fashion. And then on the opposite side is the facilities. Facilities are struggling to be more profitable in this current environment. And this system allows them in a very significant way to lower their cost centers that surround the administrative process. Again, they can then reallocate those funds to better patient care, better patient outcomes, and a number of other ways that will improve the healthcare system for you and for me. Additionally, the verification process, the current process for primary source verification of a physician is error-prone, human error, and frankly, if you have to go through multiple packets and you may just be doing spot checks. I'm not saying that's what happens, but I'm sure there are cases where that can happen. Our system with the Hashgraph integration eliminates any need for human interaction on the actual verification. The system itself verifies through the multiple facilities that are involved. This graphic shows the current state of affairs when it comes to how information flows between hospitals, healthcare systems, clinics, and doctors and licensed medical professionals. Currently, the licensed medical professional is here in the middle. And the information that they have, their medical license, their insurance, their CPR cards, advanced life support system, all of that information is the common theme that is housed within these different facilities that they work at, okay? But in most cases, and in most cases in the United States, doctors work at multiple facilities, and most of the time those facilities aren't of the same company. So there's no information flow. They don't talk to each other. There's no reason to. They want to hold the information, right? Because the current SaaS models that are in place create silos of information. And it creates silos of information of varying accuracy and timeliness. Now, IntivaHealth changes that. Our model completely is built to be centralized around the physician. The physician decides who gets to see their information. And additionally, we brought the barriers to entry down. It's free to the physician to use our platform, our utility of credential management and credential communication. It's free for the facilities to use the same utility on the other side. So now the physician can say, hey, Hospital 1, here's my credential information. Hospital 2, here's also my credential information. And Hospital 3, 4, etc. Now here's where it really gets interesting, and this is why this is so important. We're a big data play. And what's most important is efficient flow of information around all facilities around the physician. So if the physician says, hey, 1, 2, 3, and 4, you can all administrate my account, meaning you can have access to my credential repository. And they have, Facility 4 has his CPR card because he took a CPR course there, but nobody else has it. They update the information for him. Now, he can see the card immediately. It's instantaneous because it's one repository. And all the other facilities that he's ever worked at and ever has allowed access to can now see that information. And everybody is better for it. This is a huge, monumental shift from what's been going on for the last 100 years in the United States healthcare system. This has wide-reaching implications. Imagine disaster relief. Hurricane in Haiti, trying to get doctors from all around the world verified and source verified to get there to practice. With IntivaHealth, it's instantaneous, or it can be much faster. IntivaHealth sets the new standard for healthcare identity, verification, and reputation. We have a very, very unique and powerful team behind us. This is no easy task, what we've been doing. It takes a lot of experience in the healthcare space to be able to pull this off. On the executive team, we have Gary McIntosh, myself, John Hardigan, Shawn Frasquillo, Jim Comstock, Chuck Freed, and Craig. All of us have extensive experience in, first of all, startups, and also in the medical space and the technology. For example, Gary McIntosh runs our practice management organization. We actually have a practice management organization where we have anesthesiologists in multiple hospitals in Texas. So we are intimately familiar with what we are dealing with on a day-to-day basis. It is our biggest cost center, or was our biggest cost center until we implemented our software. Additionally, on the advisor side, we have venture capitalist experience. We have a token, which I mentioned at the beginning. We have some of the best guys, the Bad Crypto Podcast, Joel Comm, Travis Wright on our team, helping us spread the word about what we're doing with the tokenized medical economy and how we're completely changing the way that the United States is approaching cryptocurrencies. As well as we have deep experience in the banking and investment side with Carl Buccellato and Steve Kerr, formerly of Goldman Sachs. I welcome any questions or comments. Would love to talk to you afterwards. We're currently in our token sale right now. We just started the pre-sale, as a matter of fact, and the private sale went extremely well, and we will be continuing on until June 17th, and would love to talk to you about that if that's interesting to you. Appreciate your time. Thank you.